Hello, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH CORE. Welcome to our webinar on core certification with Security Health Plan. Next slide. I'd like to mention a few logistical items. A copy of the slides and the webinar recording will be emailed to you in the next day or so. Also, we'll have time at the end of today's program to respond to your questions. I encourage you to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. We have a lot to cover during this call. We will start off with an overview of CAQH CORE as well as core certification. Then we will move on to our featured presentation with Security Health Plan of Wisconsin. And our final presentation will be to talk about what resources we have available for you for operating rule implementation and certification. And then, as I said before, we'll have some time for Q&A. Next slide. I'd like to thank our guest speakers, in particular, Sarah Fommel and Todd Preston from Security Health Plan of Wisconsin. Thank you so much for being here today. And now, let's get started with the next slide. I'd like to introduce our first speaker, CAQH CORE Senior Manager, Taha Anjarwalla. Taha?
Thanks, Jessica. So before we begin today's presentation on certification and lead into our guest speaker, Security Health Plan, just like to give everyone in the audience a background of what CORE is. So on the next slide, CQH CORE is a nonprofit collaboration of stakeholders that include health plans, vendors, government agencies, associations, and other stakeholders that really work to improve healthcare interoperability for administrative and clinical activities. And our mission is really to drive the creation and adoption of healthcare operating rules, which serve as business guidelines that support standards and describe how to use those standards and what information may go into the standards in some cases. We were designated by the Secretary of Health and Human Services as the national author for operating rules under the Affordable Care Act, and we are also governed by a multi-stakeholder board. The image on the slide illustrates CORE's model for operating rules, which really takes a holistic and integrated approach, starting from a staged process of rule development, which involves in-depth research on potential rule areas, to bringing industry minds together to collaborate, develop, and vote on requirements for operating rules. CORE then promotes those rules by building awareness through education and offering a certification program for organizations to test for and demonstrate compliance and where those adoptions can be tracked. Lastly, we really continue to monitor industry trends for where future rules may need to be developed, and also we take in requests on how we can maintain and update existing rules. On the next slide, I'd like to just highlight kind of the various phases of rules that we've published to date, and we've developed 5 phases of rules, with phase 5 being the most recent operating rules that were just approved last month that touched the prior authorization transaction. And the core rules really do impact the entire revenue cycle in healthcare, from eligibility to patient encounters and even the healthcare payments. We are continuing to evaluate and identify where new rules could be put in place, and we are working on a new phase of rules related to attachments, which that work is now just getting started. And the use of electronic transactions of healthcare really save a lot of time and resources for providers and health plans. And as you can see from some of our CQH index data, transitioning from manual processes such as phone and fax to the use of more electronic transactions really save organizations a lot of money on a per transaction basis, and as you can see the cost on the slide. So on the next slide, I'd like to kind of highlight some of the unique benefits that each phase of the core rules bring in improving business processes of healthcare. And core certification really can help make those more transparent, and organizations in the marketplace are then able to deliver and maximize on each of those benefits. So, the use of operating rules really accelerates the delivery, accessibility, and availability of critical information, which in return provide business benefits to those leveraging the rules. An example of these benefits include improvements in revenue cycle management, such as the ability to quickly check patient eligibility and benefits prior to a visit, faster patient recognition at the time of the visit, and the ability to collect proper copay and time of service versus afterwards, reduction in provider account receivables, which really help organizations gain operational efficiencies and administrative savings, improved cash flow via expedited payments and remittance reconciliations through the receipt of electronic fund payments and remittance advices. Further, rules can really help reduce the number of phone calls when checking for status of claims or prior authorization. These really help both plans and providers spend less time on the phone and accomplishing more critical administrative tasks. And lastly, with the new set of rules, phase 5, which focus on prior authorization, these rules really help establish clear guidelines, next steps, and communicate what additional documentation may be needed to help support and automate the PA process. So as you can see, there's lots of value that each phase of the rules bring, and over the course of the next few slides, we'll talk about implementation of these rules and how to certify and test your, to ensure your organization has successfully implemented those rules. On the next slide, next one, I'd like to kind of talk about the CORE certification program. And this program really offers cost savings, industry recognition, and a market advantage for organizations such as health plans, vendors, providers that really exchange administrative healthcare information. The program is really designed to ensure that there's streamlined exchange of administrative transactions by ensuring alignment of IT systems with federally recognized and industry-developed operating rules, and the CORE certification program is really the gold standard. And there are 3 really important elements to what makes the certification program stand out. First is the fact that the program was developed by industry for industry via transparent discussion, review, and voting process. This is the same industry process that develops the CORE operating rules. Second is that the certification requires EDI-based testing and ensures an organization has implemented the rules and standards correctly. Now, this goes beyond other certification programs that only conduct documentation and policy reviews. And third is that CORE serves as a neutral administrator that ensures organizations have gone through a thorough testing and vetted process before a CORE seal is awarded to ensure that integrity and value remain. So overall, those are kind of what makes the CORE certification program stand out and kind of where value is with that program. So on the next slide, kind of like to highlight, not only does the certification program track adherence to rules and standards, but it also drives and tracks market adoption for those rules and standards as well. So to date, we've awarded more than 361 certifications across 4 different phases of rules. And I like to give some time to shout out to our most recently certified organizations, such as Eligible, Health Trio, Frontrunner, and our guest speaker today, Security Health Plan. So congratulations to all of you all. And the pie chart on this slide really illustrates that penetration of those 351 COs have on various market segments of the industry. As you can see, there's broad adoption and implementation for the phase 1 and 2 rules that cover eligibility and claim status transactions. However, there is really significant lag with conformance to the phase 3 rules that cover the electronic payment and remittance transactions. So on the next slide, I'd like to kind of highlight some key updates that we have been making to the certification program. So first is bundle certifications. And what this really means is that we are now offering a 20% discount for organizations that pursue multiple phases of certification at a time. So versus, it encourages the adoption and promotion of, more than one phase of rules, and we highly encourage organizations as they go through the planning and evaluation process to keep that in mind. And we are offering 20% off for those for more than 2 phases of rules at a time if you choose to certify. The second key update that CORE is making is that we'll be planning to launch a recertification program in 2020. And essentially what recertification will entail will be that we will require organizations to recertify every 3 years to ensure that, as systems remediations and changes take place, that we are accounting for those through a recertification process. And as we make updates to rules, those can be funneled into the recertification requirement. And lastly, the third key update is related to phase 4 certification. So the phase 4 rules cover 4 transactions: the healthcare claims, healthcare prior authorizations, enrollment transactions and premium payment transactions. So one of the changes we made to the phase 4 certification is that we are now requiring stakeholders to test for the claims and prior authorization transactions, but now we've made it optional for organizations to test for the 820 and 834. So the employer-based transactions are now optional for certification testing, so you don't have to test for all 4 at the time. It's kind of relevant to what your business model is. So on the next slide, kind of want to kind of dive deeper. You know, there's been a lot of federal activity going on from a compliance review perspective, especially with the launch of the CMS compliance program. So I just wanted to touch base on this, and many of the reasons kind of why organizations get core certified is based on the idea that, you know, there's really objective third-party testing whether your organization is conforming to the rules and standards the way they're meant to be used. And certification testing and issuance of a core seal really gives organizations assurance that they've complied with those federally mandated operating rules and standards, and you know, allowing organizations to feel more comfortable and confident in the event of audit. You know, it's kind of like using TurboTax or going to a third-party accountant to help file your taxes. It's really good practice to get somebody outside of your organization to check your work and make sure you did it right. And core certification is that kind of check for operating rules and standards. And you know, especially with the launch of the CMS compliance review program, we have found that organizations have found value in core certification, as certification can be used as a tool to help prepare organizations for those potential compliance reviews and audits through its comprehensive testing and application process. And we will be hosting a webinar series this summer in collaboration with WEDI and CMS that will really dive deeper into kind of the aspects of the CMS compliance review program, where we will actually have CMS present on its investigation of complaints received of non-compliance related to the administrative simplification requirements. So feel free to contact us, and we can definitely get you on board and register for that webinar. So, you know, how does core certification kind of help with that enforcement? So, you know, due to the large footprint of core certified entities in the marketplace, you know, stakeholders across the data exchange should really be seeing benefits afforded by the rules, and as such, CORE has a certification and enforcement process in place to really ensure there's ongoing monitoring of compliance in the industry for those CORE certified trading partners. This enforcement policy applies to any CORE certified entity, including certified health plans, vendors, clearinghouses, providers, and touches both mandated and voluntary operating rules. And to help organizations orient and navigate through this core certification and enforcement process, we've created a webpage with tools and resources that really help organizations engage in enforcement dialogue. As an example, you know, if you believe one of your training partners is non-compliant with the rules, you know, we have a letter template available to help you start collaborative dialogue with those trading partners to help really facilitate remediation efforts. You know, the use of these enforcement tools and resources really can help stakeholders collaboratively work together to resolve non-conformance issues prior to moving to more formal enforcement procedures. So we really encourage organizations to take these and kind of use these to help establish collaborative dialogue with your trading partners to ensure remediation efforts to take place before going to more formal procedures. And we're here to help guide you through enforcement kind of queries or dialogue or discussion. On the next slide. So, you know, now that you've learned and heard about the value of the rules and certification, I like to kind of level set and provide an overview of what, you know, the best path approach your organization could take when implementing and certifying on the various phases of the core rules, which we mapped to the slide. You know, this approach really starts with an assessment and reading of the operating rules themselves, followed by an analysis of internal systems to identify gaps and ensure alignment with the operating rules. And next is really an engagement of internal resources to start the project. The fourth step, which would begin with system remediation by either working internally or with trading partners to get your systems aligned and updated to conform with rule requirements. And after, you know, those systems have been remediated, the next steps would be really to pursue certification. And this way, your organizations can assure, validate, and showcase its efforts with operating rule implementation. The certification process includes submission of various documents, followed by certification testing, and we'll hear more about this kind of over the course of the presentation, kind of diving detail into each one of these steps. And And overall, on average, most organizations are able to complete the certification process within 3 to 6 months, and core staff are really available to help you navigate through each step of the implementation and certification process. And before I kind of close off my part of the presentation, over the remaining course of the webinar today, we'll be hearing from Security Health Plan, about their certification experience, and then we will then dive deeper into kind of these 6 different areas into the certification process, really discussing the resources that are available to ease and support core certification. So with that, I'd like to hand the call to Jessica for our next polling question.
Thank you, Taha. So let's go ahead and launch the first polling question. This question is going to help us in our planning efforts to make sure that we provide you with the best information and customer service we can. So we'd like to know what whether you're thinking about pursuing core certification this year, next year, or if you're just here to learn and see whether this is something that makes sense for your organization. And if you're not interested or you're already core certified, well, for those of you that are core certified, thank you so much for being here. This program only works because we work with you to kind of keep moving it forward.
Great, thank you. So again, Security Health Plan, our logo or our motto is "Promise is kept, plain and simple." Our mission statement is, next slide, we enrich lives by helping consumers and communities reach their best health by ensuring access to affordable and high quality health care. We really strive to really do what's best in terms of for our members and keeping our costs low. Who are we? You can go to 2 more slides. So we started out by as a Greater Marshfield Community Health Plan back in 1971. We were developed as a way to help Marshfield Clinic's patients pay for their care. We were the first rural HMO in the nation. It was a partnership between Marshfield Clinic, St. Joseph's Hospital, and Blue Cross and Blue Shield. It was spearheaded by Russell Lewis, a Marshfield native, and then Congressman and Secretary of Defense Melvin Laird, and Ben Lawton, a physician. They made decisions, and eventually we evolved into being Security Health Plan. We try to do the right thing for our members, and all of our decisions are based off of doing those right things for the members and making it easier for businesses to thrive. Security Health Plan remains a part of the Marshfield Clinic Health System family. Next slide. We have nearly 250,000 members. We're the 6th largest HMO in the state, serving 59 counties in Wisconsin. We're in the top 10% of health insurance plans for quality nationwide. We offer an outstanding provider network through Marshfield Clinic physicians, and in some markets we feature products that include Mayo Clinic physicians as well. Next slide. Our plans are also nationally recognized for excellence, where you have world-class customer service. We've received multiple quality awards within the world for our world-class call center. Next slide. So now we'll go into talking about why did SHP pursue core certification. Obviously, there's a number of reasons. First and foremost was to develop those consistent business processes for providers to create efficiencies and ensure accuracy. It's also ACA mandated, and then having that certification / seal for proving to all of our provider partners that we are dedicated to the quality and wanting to leverage any electronic efficiency that we can. Because as everybody continues to grow, there seems to be more and more that's put on and to ensure coverage, to ensure the correct eligibility. And so we want to really prove to our provider partners that we're in this for the long haul. And then also our Marshfield Clinic Health System CEO, Dr. Susan Turney, serves on the CAQH board. So we wanted to make sure that we were supporting her in terms of having her own health plan certified under this as well. Next slide. So what was our process? So the recommendation was for us to do a full preview of all the rules, and CAQH CORE said that they would do that along with us. We did decline that because we had been looking at core certification for several months, actually probably over a year to 2 years, And so we had done all of that full preview, really researched the rules. We felt that we were in compliance and felt that we didn't need that full preview of the rules. But if you haven't done that, I would highly recommend that piece. So we have a prioritization group here, and so we put this as a roadmap item. Then it got prioritized, and once that roadmap item got up to when we were able to kick it off, we always create what's called a solution concept document that's really outlining who needs to be involved, all the steps that it's going to take, what's in scope, what's out of scope. So that's something that is unique to Security Health Plan in terms of calling it a solution concept, but I'm guessing that that's not something that's unique to most organizations, the concept. We also assigned a project manager for this project because we knew that it would take a lot of coordination and a lot of back and forth. So we wanted to make sure that we had one main point of contact that was pulling in both the IT resources, the business resources, and then communicating both with CAQH CORE and EdFX. We created a dedicated team comprised of both members from our claims team on the business side, members of our business configuration team. We had provider relations involved in terms of any outreach to providers that we may have needed, and then obviously our IT staff. We created a dedicated environment within our QNext platform for testing with EdFX. We went through the configuration of the environment with all of the data supplied. That is something that we felt was very labor intensive. It took us a little bit by surprise for how long that took, but we worked through it step by step. We met with CAQH CORE. We felt that they were very helpful and knowledgeable and were able to clarify questions quickly about the rules. There were several things that we felt were up for interpretation, and so it was ones that we would just hop on a call with CAQH, and we were able to get our answers answered quickly. Once the services were connected to EdFX, the execution and updating of the tests were able to be completed fairly quickly. Next slide. We did run into some difficulties. We ran into issues with getting timely responses from EdFX. One of the example would have been a time zone calculation issue, and we did have to go back and forth, and that did prolong things. Like I said before, the language and the requirements can be confusing and needed clarification on interpretations. We needed to reach out a few times, which caused a few delays. Because of some of those delays, and I won't say it's because of all of that, we did have competing projects as well for several of our resources. So we had resource constraints, but we had to extend our pledge time frame a couple of times due to those delays. So I would recommend that plans keep that in mind when you're planning out how long it's going to take for this project. We received our certification end of April, early May, and I believe we kicked this off back in October and started doing our initial planning. So it did take us a little bit longer. And again, I don't think it was solely because of not getting timely responses. It had a lot to do with the competing priorities and resources that we had at the health plan as well. Next slide. So our overall experience, even though it was a longer process than what we initially expected, phase 1 and 3 were a positive experience. We do still see that some of our trading partners want the core certified version, but we also have some that want custom. So we did develop our process to support both the custom processes and the certified process. CAQH was very responsive throughout the certification process, and now we're trying to use this as leverage to get more of our vendor partners core certified as we find value in these standard transactions. So there's several vendors that we use that are not core certified and that we struggle with some of the transactions that we have. And so we are really trying to push them to the standardization as well.
Thank you,
We're happy
Sarah.
to answer any questions, and we're happy to, if people want to outreach to us directly too, we would be happy to answer and be a resource.
Thank you, Sarah. That was really helpful, and I was just amazed listening to your presentation. You guys really did everything that we, would recommend, didn't think of recommending, but you guys, your process was amazing. I think it's something we can all definitely learn from. So now we're going to go to our next polling question. Let's go ahead and launch that poll. So we'd like to hear a little bit of feedback from you, which benefit of certification kind of resonates with your organization the most. And this is a check all that apply. So I'm going to give this a few seconds, and then I think it makes sense to share this poll result. And Taha, I'd like to kind of hear what you think.
Sure.
Give this sort of, let's go ahead and share the results. So what do you think of how our attendees are responding?
So I think this kind of aligns with some of the trends and we've heard from those that have come to us kind of requesting more information about certification. So it looks like 70% have remaining competitive industry. So this really hurts here, is that market advantage of what that course will bring, especially for vendors and clearinghouses and from that perspective. And then I think the rest is kind of looking at the implementation of these sorts of rules are federally recognized, and also ensuring you're being proactive with those CMS conformance issues. I think about 50% checked yes to that question. So I think that aligns with some of the trends of ensuring confidence and value that you've implemented things correctly and preparing for those audits. So I think it aligns well with what you've heard from the industry as well.
Yeah, and just one observation is that these rules have been federally mandated long enough that it kind of makes sense that that first option is a little bit lower because people sort of have been worrying about this for a while. And so now it's about market advantage. It's very interesting. So let's go ahead and close the poll so we can move on to the next section. And now I'd like to introduce our next speaker, Core Associate Adam Nichols. Adam?
Thanks, Jessica. First, I'd like to thank Security Health Plan for providing us with their overall experience through the core certification process, as it's always helpful to have the perspective of the health plan that's gone through certification. Today, I'd like to dive into the core certification process itself with what resources are available to you as an organization testing for the core certification. For each phase of core certification, the core certification process is broken down into 4 components to better help your organization navigate through the planning, testing, and applying for the seal. Component 1 relates to the planning and evaluating systems process prior to beginning core certification. For this component, organizations review and understand the requirements of the operating rules and scope resources needed to adopt and implement those rules. The second component outlines the steps an organization needs to take when it is decided to pursue core certification. This component involves the signing and submission of the core pledge in correspondence to the phase being certified. The pledge of the intent of that pledge is to formally communicate an organization's commitment to pursue core certification. And the third component relates to the core certification testing. This outlines the steps and provides resources to help organizations navigate the testing process. Some organizations are challenged by this component due to the amount of resources involved, such as what Security Health Plan had mentioned earlier. In the fourth component, and the last component of the core certification process relates directly to the seal application for the core certification seal. Applying for the core seal involves the submission of 3 sets of documents for each phase that an organization is applying for. These documents include the core seal application form, the HIPAA attestation, and a seal fee. As part of the planning and implementing the core rules, you can access the e-learning module, which is an interactive tool that helps your organization navigate and drill down the necessary requirements for each component of core certification. Next slide. One of the resources that we have available are the FAQs with hundreds for each operating role. These are the questions that we've received from organizations going through the implementation and certification process submitted through our email inbox. As we would see both common themes and technical questions come in, we would then develop and turn those questions into FAQs. So these FAQs consist of real-world interpretation or assessment questions on the operating rules or certification process, which we have broken down into question and answer format, where you can search by keywords or specific topics. For example, the core certification FAQs include topics around applicable core rule requirements for different stakeholders, or how those operating rule requirements can be outsourced by other organizations. Next slide, please. Another resource that is available to organizations testing for core certification is during the pre-certification and system evaluation, organizations should review and understand the requirements, the operating rules, and scope resources needed to adopt and implement those rules. A very important resource that CAQH CORE offers is the Analysis and Planning Guide. We offer this for every phase, phases 1 through 5 as of now, and there's a separate guide for each phase. These guides have separate tools within it, so not only can you do a quick assessment, we can do simple checks of yes or no, and identifying if a general operating rule applies, such as does my organization commit to real-time or batch, or perhaps both. Further, the guide still offers drill-down tools where you can check operating rule requirements line by line, determining whether or not they apply, and whether or not it's a business impact, is it a technical impact, or does it help your organization identify remediation strategies, such as making software changes, business process changes, or even using it for education or communication opportunities where you need to engage with other departments within your organization, or possibly a trading partner. This tool helps you map touch points between systems and business processes to help streamline implementation of the operating rules. Further, all of our tools and resources are free, so you can access them via our website. These tools can be accessed before the formal start of your process of the core certification. Next slide. So in this section, after having identified and resolved any necessary gaps in preparation for core certification testing, an organization can move forward with creating a testing account under a CAQH CORE authorized testing vendor. There are 3 different types of testing components core certification applies to. The first, which being the transaction-based task, which involves setting up a connection with an authorized CAQH CORE testing vendor and testing for the transactions associated with the phase for which you are pursuing. The second, uploading documentation, requires that the organization testing upload appropriate documentation applicable to the operating rules. Examples include companion guides, communication log files, and notices of any regularly scheduled downtimes. The third and final type are attestation-based tasks involving attesting for current or planned conformance to the operating rules for which they are testing. Next slide, please. So this question is more applicable to the questions that come up regarding organizations. So on this slide, we've provided some guidance depending on the types of questions or challenges that you have and who to connect with for guidance regarding the core certification process. If you're not sure on what question relates to you, feel free to contact us for more support. And that's it. Thanks, Jessica.
Thank you so much, Adam. That was really helpful. And, just to highlight that CQH CORE staff are ready and willing to help you at any step of your process. So let's go ahead and do one last polling question. We really do like getting feedback from our audience because it helps us learn and keep moving forward. So now we want to hear about what barriers you face. And this is, again, a select all that apply, and this just kind of helps us know what's keeping people from core certifying and also how can we help. So let's keep this poll open for just a few seconds. And again, Taha, I'm going to put you on the spot because I think it'd be great to kind of share this and see what you think. So let's go ahead and share the results. So what do you think of?
Yeah, so it looks like there's a three-way split between budget constraints, knowledge gaps, and technical obstacles. So looking at budget constraints, I think the more we can showcase the value and ROI that the rules offer, I think the more hopefully we can get those added to kind of organizational budget. So those are some key themes that we're working on and can help provide you with estimates some of those cost savings could be. And kind of with knowledge gaps and technical obstacles, we can definitely offer you support. We've got to get on a call and kind of walk you through, what are some of your questions, what are some of the gaps in your systems, and help you identify what those remediation strategies are. So, we definitely, feel free to reach out to us, and we'd be glad to kind of connect with you and kind of walk through any sort of questions you have. And from a budget perspective, we can help you figure out what that ROI may be for your system. So, good to know.
Yeah, thank you, Taha. That makes total sense. I'm glad we asked this question because we learned a lot from the answers. So now we have some time for Q&A. Let's go move on to the next slide. If you'd like to submit questions, please type them into the questions panel on the dashboard. And in the meantime, a few questions have come in. Mostly for Taha. So the first question is, what is the cost of certification?
Yep, the cost of certification really it varies depending on your stakeholder type and the net annual revenue you make. It could range between, $4,000 to $9,000. And I think I mentioned earlier in my presentation, if you do decide to pursue 2 or more phases of certification at a time, we do offer a 20% discount. Our costs are transparent, and they're available on our website if you need to do a quick look, or you can set up a call with us and we can work through what that pricing may be for your organization.
That's great. And we did get a couple of questions about ROI, and I feel like this is sort of tied to this. So can you talk about that?
Sure. So with some of the ROI, we really work closely with CAQH Exploration, which produces the annual index report, which tracks, the cost savings organizations can implement for receive for transition to electronic transactions. So a lot of ROI data and cost savings comes from there. And we really encourage organizations to participate in those efforts. It really gets a good understanding of the industry at large and what that cost savings may be. And then, there are calculators on the website. So if you're interested in participating or understanding more about what those cost savings can be, feel free to contact us and we can work with you.
Great. And, one last question has come in. Someone who's working on PA and managing their PA process, and they have questions about what CAQH CORE is doing in this area.
Sure. So with prior authorization, we just recently launched the Phase 5 core operating rules that touch on this topic. But before Phase 5, we touched and covered prior authorization in the Phase 4 rules, which really established a key foundation and infrastructure requirements for common connectivity, acknowledgements, security, and use of that prior authorization transaction. And with Phase 5, we expanded on that and added in additional requirements for data content and use of prior authorization for web portals to really support the automation of those electronic processes. So, when a prior authorization is pending, how additional documentation may be used to communicate back. So really to speed up that process, we've developed 2 phases of rules that cover that topic, and we're continuing to do more work around PA. We have a task group that's working on final determination of, what is the start to end time for a full PA. So we have a lot of work going on from a prior authorization perspective. And then, if you're interested in learning more or joining us, feel free to contact CORE, and we'd be glad to get you on board.
Thank you, Taha. And we did receive one last very timely question. Someone asking, they want to learn about CMS compliance programs, and it's sort of a perfect segue to our next slide, which includes our upcoming events. We're happy to be collaborating with WEDI and CMS on 2 webinars on their compliance efforts. The first webinar is next week. And then specifically on the CMS compliance program, we do have a webinar on July 8th. You can click on those hyperlinks and register that way, or you can go to our website or the WEDI website to register. And then we also have a webinar on attachments scheduled for July, and I know that's not on CMS compliance, but I know it's a topic of great interest to our audience. And with that, let's go to our final slide, which is just a thank you to our speakers and to our audience for joining us today. And these are ways to communicate with us if you'd like to ask a question or want to give us some feedback. Thank you very much.